Hi everyone, I'm Dr. Armani Abdul-Razak. I am an aesthetic medicine physician in Calgary, Alberta. If you're here, it's probably because you follow me on Instagram, my small but mighty following, so thank you for that. I just thought I'd start educating a little bit more on YouTube. These are not going to be professional videos, but it's just a way for me to kind of get into the nitty-gritty a little bit more for people who want to get into the science. Instagram's not a great place for that. So the first topic I want to talk about is topical estrogen for the face. So this is for maybe the 40 plus woman, or perhaps the woman with early menopause, but generally the 40 plus woman who's dealing with perimenopause, menopause, and is experiencing the typical symptoms of dry skin, dry facial skin, lines and wrinkles, thinning skin, loss of elasticity, loss of overall radiance. We talk about sun aging as being a major factor in aging, but definitely when estrogen starts to fall off a cliff, then we start to see things like these skin changes that I'm talking about. So, in addition to the oral or systemic hormone therapy that people are talking about, like the transdermal estrogen patches, the creams, progesterone pills, all that good stuff that is good for whole body health, there's actually some science that tells us that that kind of systemic hormone therapy helps with facial aging, skin aging, but also the question has been risen as to whether or not topical estrogen creams can also add on and help with facial skin aging. Most recently, there's been a product that's been making some buzz online that's known as the M4 Alloy Skin Cream. And this has made a splash because some high profile dermatologists and women's health experts have been behind it. And so one of my patients actually brought it up to me a little while ago, asking me what I thought about the alloy cream. And this is a topical estriol cream. So when we talk about estrogen, we most commonly are talking about estradiol as the most common powerful form of estrogen in the reproductive years. Estriol is much less potent, and we see that in higher concentrations during pregnancy. And then estrone is probably the more dominant one, also weaker, but the dominant one in the postmenopausal phase. So the question is whether topical estrogen cream can help with facial skin aging. And a subset to that would be, well, does topical estradiol cream help with skin aging? Both have actually been studied. And what impressed me about the alloy cream study is that, first of all, it was well conducted. So for myself, having a background in health research methodology, my master's degree in that, I'm really able to look at a study design and kind of decipher how high quality the study design was and whether it was built in a way that can actually answer the question that it was set out to answer. And a lot of times in the beauty world and in skincare, it's a little bit of a wild west. People make all sorts of wild claims based on minimal data, poor quality studies, and sometimes, we're looking at no clinical evidence at all, and yet people are making these claims. So in this case, I was skeptical as always, but I was pretty impressed to find out that actually the people behind Alloy had hired, I believe it is an independent third-party investigator to do a randomized control trial. A randomized control trial is, classically known as the gold standard, and they actually took 90 women who were postmenopausal and not on oral or systemic hormone therapy. So 90 women is a pretty decent size for a skincare trial. I think some of the retinoid studies, like retinoic acids, they are looking at into the 200s, close to 300. But other than that, skincare studies tend to be quite small. Also, they followed these women up for 12 weeks. So sample size was pretty good, 12-week follow-up, pretty good. It was double blinded, meaning both the person receiving the cream in the study and the person assessing their results, the investigator, had no idea whether they received placebo or the estrogen cream. And actually, to go even further, so Alloy compared their product to a placebo, which is just basically the vehicle cream or the moisturizer that the Alloy comes in. But not only did they compare it to placebo, which is good, they also compared it to topical estradiol. And this I thought was awesome because people are often talking about, well, estriol is weak. Why not use topical estradiol? And there are questions as to whether estriol is effective enough. So they went ahead and compared it also to topical estradiol. The concentration of the estriol cream was 0.3%, and the estradiol cream was 0.01%. And that just reflects rough understanding of what's equivalent because the estradiol is stronger. So the main investigator is a very sort of highly respected dermatologist who does a lot of these studies. At the 12-week mark, the main outcomes that were looked at was her assessment of various skin aging markers, such as elasticity, radiance, and hydration. So let's get into the results. I won't get into the absolute nitty gritty, but I will say what is relevant is that at 12 weeks, they found that in general, the estriol and the estradiol group had similar-ish results. They weren't really statistically significantly different, but they were both better than placebo. And at the 12-week mark, they found that people in the estriol group had 48% improved radiance. I actually have the notes in front of me because I can't remember the exact percentages, but 48% improvement in radiance, 57% improvement in roughness, tactile roughness, 70% improvement in hydration, and 88% improvement in elasticity. Again, the person assessing these results was blinded as to whether it was the estrogen creams or the placebo that they were looking at. So that's pretty impressive. And these results are ones where people, the user, can readily identify. It's not one of those results where it's like, oh, great, it's 12%, but like, what does 12% mean? Am I going to notice that if I use this cream after 3 months, or am I going to think, I'm not sure if it's working? No, these are numbers that are pretty significant and what we call clinically significant, meaning that the user will notice those results. So, and at 12-week, that's pretty good. Perhaps we can expect these results to improve with longer duration of use, but we don't have a great deal of data to support that. The other things that they did that were interesting was they actually measured blood levels of estrogen, so estradiol and estriol, and they found that none of the groups actually had an increase in these blood hormone levels, which is good, and that's been something that's been raised as a safety concern. And then lastly, they found that there was no increase in pigmentation or melasma. And that has also been a concern. Now, I will say that it's not that we have confidence that these estrogen creams in the long term, say after months of use, won't potentially worsen melasma in some cases. And I say that because this study was not set out to ask that question. So it's not, it's not a big enough study or designed in a way that we can have confidence to say that, oh yeah, for sure, this does not worsen your melasma. We definitely need more studies to give us confidence in that regard. And I would say while this was a really well done study, and I honestly gold star, we still need more similar studies that can be repeated and hopefully replicate these results to give us further confidence. And hopefully they're also measuring blood estrogen levels so we can have further confidence that this lower concentration of topical estrogen-based cream does not increase our blood levels of estrogen. Now, you might ask sort of what other data we might have to support the use of topical estrogen cream. And there have been smaller trials in the past, it's ones that are going into the early 2000s to the mid 2000s, ones that sometimes looked at women who were also on oral hormone therapy and showing that the addition of facial estrogen creams can still improve facial aging despite the fact that they're on oral hormone therapy, which is interesting. And another one that looked at estrogen cream versus, so it was estradiol versus glycolic acid, 15%. And they found that this was also a double-blind placebo-controlled trial, and they found that glycolic acid actually improved skin thickness just a little bit more than the estrogen cream. The estrogen cream did well, glycolic acid did better, which is really good to know, because if you cannot, for whatever reason, use an estrogen face cream, or you don't have access to a doctor who can prescribe it to you, you don't have to have major FOMO. I think the best results are still going to come from the tried, tested, and trues, your retinols, your sunscreens, your vitamin C, other antioxidants, and perhaps things like glycolic acid that also do a really great job. But what they found in that study was that adding glycolic acid and the estrogen creams together actually gave the best results. So I guess the message here is, if you've got a nice foundational skincare routine that is working for you and you want something extra, and again, you're in that 40 plus category, you think your hormones are, changing, then perhaps topical estrogen cream is something you can discuss with your doctor. So I think, I just want to be clear, none of this is me saying you should definitely be on estrogen cream. It's just really interesting data. I hope there's going to be more similar studies to support this. And if this sounds like something that's interesting to you, maybe chat with your doctor or check out the Alloy website. I know they offer teledermatology where they can sort of prescribe and deliver to your house. It looked like it was around 150, 160 US dollars, probably plus delivery fees. So it's not cheap, and that's probably a 3-month-ish supply. The alternative, honestly, is to use, this sounds sketchy, but to use vaginal estrogen creams. And I've heard of women using vaginal estrogen creams on their face, and that would be way, way cheaper. I'm not sure about the delivery system of these vaginal creams and whether that would actually allow for adequate penetration in the skin, and how that compares to something like the Alloy cream and its vehicle and how well that allows penetration. But I have seen even some of the dermatologists that are behind the Alloy product suggest that if you can't afford it, to consider a vaginal estrogen cream. So maybe mixing that in with your favorite moisturizer is also a way to go if budget is a consideration for you. Anyways, that was my take on topical estrogen creams. I hope you found this beneficial. And what do they say in YouTube? I don't know. Comment below if you have any questions. Don't subscribe because I don't really have a channel yet, but maybe in the future I will. Thanks. Bye.